Good evening, everybody. My name is Dr. Dennis Goodman. Welcome to the Heart Health Lecture Series at NYU. I'm a clinical professor of medicine at NYU in the Department of Cardiology, in the Preventative Medicine Department, and the Director of Integrative Medicine. As you know, many of you are longtime supporters of this program, and it wouldn't happen without Anya, and I want to thank her publicly, as I always do, for her incredible efforts. I also want to thank Michelle, who's been amazing in getting us sorted with all the logistics and the IT and the PR, etc. I'm very excited tonight. Michelle, Anya, can we have the next slide? Next slide. So first thing, a little bit of logistics. Things are very different now, as you all know, but we have a way for you to ask questions. And you can see your screen. You can see at the bottom of your screen, you'll see something that says Q&A, which is question and answer. At any time during the presentation, you can type a question to us. Obviously, if you make it concise and short, it's easier for us to answer it. But please feel free to ask questions. I'm going to take them and read them during the talk, and we will ask our speaker at the end of the program the questions. Next slide. So there are upcoming Heart Health Lecture series and webinars. Please put these dates down. Women's Health Update, Wednesday, February the 24th, between 5 and 6 p.m. And then on Wednesday, the 31st of March, Seasonal Nutrition Eating Patterns. And please sign up for that. And you can see you can register online, and there's the web address, the email address. Next slide. So this is our Heart Health Lecture Series that's been going now for about 5-6 years. Here's our website, our email. We also have a Twitter account. We love your feedback, so please don't hesitate to be in touch with us. Tell your friends about it. And there's the email address, hearthealth@nyu-langone.org, if you have any questions or you want to register for the lectures. Next slide. So we've seen a lot of different topics over the past few years, and I'm not going to go over them. But as you can see, they're very focused on prevention, very current, and we've done a lot of topics, over 50 topics, and we're starting to recirculate them because many of them are almost getting outdated from a few years ago, and we like to keep you up to date with what's going on right of now in the field of preventative cardiology and preventative medicine. Next slide. It's my pleasure tonight to welcome our speaker. I think you all know that I'm very focused on an integrative, holistic approach to cardiology and to medicine. And I often say that wellness is not the absence of disease. You have to be proactive. You have to work at keeping yourself healthy and trying to prevent bad things from happening, and certainly help to prevent a bad thing from happening for a second or third time. And that takes work, it takes effort. And really what this program is about is to give you the power to educate you. Knowledge is power. And so I'm constantly looking for speakers that can inspire you and can help you to do just that. I am very focused on 4 aspects of wellness, and they are nutrition, exercise and flexibility, sleep, and stress management. And so you've seen over the years how often I have a speaker in the field of stress management. And tonight we are very fortunate to have Dr. Mary Carol Mazza, who is a PhD and a licensed clinical psychologist with specialized training in the areas of stress, anxiety management, trauma, coping with chronic illness, and health psychology. She completed her PhD at the New School for Social Research and her postgraduate training at St. Luke's Roosevelt Hospital and the City University of New York. Currently, she works as a clinician and clinical instructor in the Psychiatry Associates Faculty Group Practice at NYU Langone. She's new to NYU. We're delighted to have her. She's already very busy. But after your talk, Mary, I'm sure many people will be writing in and calling in to come and see you. So welcome. Thank you for coming tonight. And we're looking forward to your talk, which is about meditation and health. Over to you.
Thank you so much, Dr. Goodman, for that wonderful introduction. And thank you to this audience for your interest in integrative medicine and this kind of fascinating overlap between how we manage our physical health and our overall emotional health and well-being and the interaction therein. So thank you for the opportunity to speak. Next slide. Just to give you an overview of what we're going to be covering today in this presentation, I'm going to start by talking a little bit about stress and the mind-body connection. Based on that list of topics that Dr. Goodman showed just a moment ago, it sounds like that's something that's been discussed in this seminar before, so I'm glad that everyone will already have a little bit of a primer, but I will definitely refresh your mind on that topic. And then we'll get to the heart of what I want to focus on for the rest of our time together today, which is meditation. I want to talk about what it is, how you do it, how you begin to organize a regular routine and practice of engaging with it, and what the impact is on not only your emotional health, but also your physical well-being. Why is it important to you? We'll do a mindful breathing exercise together, which is one particular kind of approach to meditation, this idea of mindfulness. And at that point in our presentation, you will know more and understand more about what it means to practice being mindful in a meditative context. And we'll also talk about what research tells us just about this link between meditation and health outcomes. And specifically, we'll spend a little time focusing in on cardiovascular outcomes, since I know that's a primary topic in this group. I'll also leave you with some additional resources beyond just what I talk about today, as well as the references for my presentation and my contact information, because I always love to hear from people who are interested in continuing their study of meditation. And if I can be useful in that process, I would love to. All right, so let's get started. Next slide. I had this kind of slide in place in part to just introduce my own theoretical orientation and background, which is very based in an integrative medicine approach as well. I myself am a psychologist, but I operate from a biopsychosocial theoretical framework of understanding, which means that even when I see someone for a primarily psychological, cognitive or emotional health related issue, I'm always working to understand and acknowledge the fact that our biology or our physical experience is intimately linked to our psychology as well as our social environment. And that basically all three of these factors are interrelated. So when we approach any particular problem or issue in one of these areas, it's incredibly important to think about supportive interventions and treatment approaches that address all three, because they're all very interactive. Next slide. Now, let's get started in our talk about meditation specifically today by acknowledging this concept of stress and how stress is very much related to our mind and body interaction or connection. So what is stress? Stress is a term that we overused today in many ways, but the actual word stress refers to a physiological response in our bodies that's triggered by the exposure to something particularly difficult or challenging in our environment that we don't really feel equipped to manage or handle. What happens when we perceive kind of a threat in the environment and this stress reaction occurs is that our brain sends signals to the rest of our bodies, to the rest of our body systems, to engage in activity that helps us become safe from this threat. Now, there are a variety of physiological processes that I won't bother to kind of explain in depth today, but the outcome of many of those processes involves increasing the production of a hormone called adrenaline and a hormone called cortisol, which allow us to kind of do as much as we possibly can to escape. So make access to our energy sources easier, focus in our body's activity on moving, on alertness, on getting away as fast as possible, and to suppress other systems of functioning that might inhibit our ability to kind of save ourselves in this moment. One of those systems that gets suppressed in this process is our immune system, which is of note as we continue to talk about kind of this mind-body interaction. Now, traditionally and evolutionarily, this system of response to a stressor or an emergency in our environment, it's designed to happen in a very discrete and small period of time. So the idea is you need to kind of activate all your resources to save yourself as quickly as possible. And then your body can go back to kind of working on balance or homeostasis and counteract this activity of the stress response. But we live in a very different world than our earlier hunter-gatherer selves. And at this moment in time, often the kinds of stress that trigger this response in our body are more chronic or more kind of consistent in our everyday lives. It can be something simple and definitely every day, like interacting with your finances or worrying about budgeting money. It can be something much more kind of singular and traumatic, like caring for a loved one as they deteriorate in their health or cope with a terminal illness. It can also be situations like managing the risk and constant fear of physical compromise that are elicited during a deadly global pandemic. That is not an example that I ever thought I could reasonably use in a presentation, but this is where we find ourselves today. So it's important to recognize that in our current environment, we're kind of constantly activating this stress response, and we don't have a lot of time to de-escalate it or find balance within our physical experience because of the stimulus that's coming at us in a variety of different ways, in the pandemic and also in our larger lives. Now, what happens if this response is kind of chronically activated? Well, lots of negative things. From an emotional perspective, this chronic activation of response often triggers strong emotions like anger, fear, sadness, worry. From a behavioral perspective, we often get a lot less careful in the decisions that we make. We become a lot less rational in our thinking. We become a little bit more impulsive, a little bit more focused on our worried thoughts. And that can lead to kind of negative choices about our behaviors. And from a physical perspective, there are all sorts of downstream implications. Increased pain experiences, digestive problems, losing your hair, hives, muscle tension, and potentially, if this system is activated for a long enough time, you're also looking at kind of chronic problems in your brain functioning, cellular death in different parts of the brain. So all of this is to say, it's incredibly important, especially in moments like the one we find ourselves now, to consider approaches, active approaches to kind of signaling to your brain and your body that you're safe, that you're okay, that even though there are things to worry about, now is not a moment when this stress response needs to be raging in the background. And the meat of what we'll talk about today is one particular approach to working on kind of signaling that part of your brain that creates balance and deactivates stress, which is creating a space of relaxation. And one of the ways that we do that, next slide, is with meditation. So today, I want us to spend some focused time thinking about what goes into meditation and exactly kind of how we get to this more relaxed physical state that helps to de-escalate our stress response, and what some of the other really kind of positive outcomes of a practice of meditation can be for you in your day-to-day life. Next slide. All right, so meditation is not new. It sounds like this is a topic that's been covered maybe in a couple of your other lectures, and it looks like from that quick identifying list of topics that transcendental meditation was probably what you focused on in the past. So I'm guessing you have a little bit of a sense of the fact that meditation has been around for thousands of years in a variety of different forms. Now, I mean, obviously I'm a psychologist, not a spiritual guide or a religious philosopher. And so the way we think about meditation in our day-to-day, very non-secular society is focused outside of any particular religious orientation or even spiritual goal necessarily. Meditation in and of itself is really an exercise for your attention. I like to tell my patients it's often like lifting weights for your attention, which I don't know if it makes it more appealing to people, but I think it definitely gets across the fact that it's something you have to work at. It's not this passive process that you just find. It's something that requires a lot of activity on your part. And that activity goes into really focusing and directing your attention in specific ways. Now, you might ask, aren't I focusing my attention all the time? Yes, of course you are. I want you to take just a moment and reflect on, how is your attention focused most of the time? Do you feel often that your attention is focused in very specific ways? Or is it kind of constantly bouncing between a variety of different things? I know for myself, in a moment to moment way, I'm distracted by my phone, by a notification, by someone emailing me, by the idea of planning ahead for what I'm doing next week or this evening, by looking back at the past and thinking about kind of processing or understanding what's happened before this current moment. So oftentimes our attention is kind of constantly bouncing. And while we consider ourselves good multitaskers, it's very difficult to harness the activity that it takes to really fully direct your attention in one specific way when we've become so trained by the environment around us and by our own experiences to constantly be letting that focus kind of get hijacked by our internal experiences as well as things happening in the world around us. So as I mentioned, meditation and this act of working to focus that energy and activity in a specific current present moment way, it requires discipline and a lot of regular practice and training. And it can be achieved, this act of meditation, in a variety of different ways. And today we'll talk a little bit about really kind of what the core activities of meditation involve, and then use two kind of different kinds of meditation to understand a little bit more specifically about how those different types of meditation kind of get us through this process of working to actively focus our attention. Next slide. Okay, so let's break down, what are some of the core components of meditation? What is it that you do when you meditate? What is the actual process you're engaging in? And what are the outcomes? What's happening? What are the skills that you're utilizing when you actually engage in this process? So as I said a moment ago, the somewhat kind of abstract definition of what you do when you meditate is you focus your attention in an organized way on a very specific experience or stimulus. And the core of what that experience or stimulus is that you're focusing it on tells us a lot about what kind of meditation you're actually practicing, or the skills that go into the particular approach you're taking to stay in the current moment. So some of those examples of experiences or stimuli that you might focus in on when you're working to meditate and to focus your attention in an organized way. It could be your physical presence, it could be your breathing, how you feel in your body in a moment to moment way. It could be your thought process. There are certain types of mindful meditation that encourage you to notice every thought as it comes up and to kind of label that thought. That's a worry, that's a plan, that's an observation. And to really pay attention to where your thought process wanders, where that wandering mind goes, and to learn from where your mind takes you, how to bring yourself back to the current moment. Another area of focus could be feelings or emotions. Sometimes it's important to focus in on how you're feeling right now. And at other times you can use an emotion as a kind of experience to concentrate on to try and also elicit that sense or feeling now. There are also several kinds of meditation, and transcendental is one of them, that focus on a mantra or phrase or even a theme. Loving kindness is another meditation that kind of falls into this area of focusing in on a theme. But an example of a mantra, for those who aren't familiar with it, is kind of the stereotypical one used in transcendental meditation, which is a repetition of the single syllable mantra, Om. Om, Om. Feeling very aware of my non-vocal talents as I do that, but that's an example of kind of what it means to engage with a very simple mantra. Another example could be a visual image. Often for people, one of the primary complaints or barriers or struggles that I think people engage with is just the challenge of constantly bringing yourself back to the here and now, and how hard it is to kind of break away from the other processes that interfere with your ability to do that. And sometimes a great way to start with meditation is to kind of give yourself an external focus to begin with. If you try to start right away with tracking your thinking, it can get pretty overwhelming pretty quickly. Our thought processes in our brains can be a messy place, and it's often a great strategy for a beginner to kind of focus in on one specific thing. And as you'll notice, when we engage in a mindfulness-based exercise a little later, we're going to really work to focus in on our breath, and we'll kind of focus in on our bodily experiences. But there are a lot of different ways to do that, as I mentioned, and a visual image would be one of those. Okay, now let's shift and talk a little bit about what's happening when you're actually doing this work to focus your attention in an organized way on your experience. The first thing on this list is physical relaxation. Now, take your mind back to a few moments ago when I was talking about stress and stress activation. Now, the act of focusing in on your current moment in an organized way, it reminds you of what's happening in the here and now. Now, even though there's a lot of chaos in the world around us, if you're giving yourself a moment to actually meditate, that's probably going to be happening in a room where you feel safe, in a place where you feel that you can actually relax or let your guard down. So it's generally a safe space. And when you focus in on observing that space in the here and now, it's the most basic kind of concrete and visceral reminder that you're okay, that your brain doesn't need to constantly be on alert for a threat. And that awareness focuses in a very biological way our ability to kind of turn down the volume on this stress response and work to allow our brain the space to kind of trigger those other homeostatic balancing responses within our body. So physical relaxation is one primary outcome of this focus. It also allows you, when you kind of try on this exercise of meditation, to work toward moving away from well-practiced thought patterns to kind of quiet the mind. Now, what do I mean by well-practiced thought patterns? Well, as we were talking, or as I was talking about a moment ago, our minds tend to wander quite a bit. We find ourselves planning for future goals. We find ourselves judging current behaviors of ourselves and of others. We find ourselves rehashing things that have happened in the past, either because they make us feel good, or maybe they make us kind of engage in really being hard on ourselves and thinking about how to change or do something differently or take control. All of those practice patterns of thought create a lot of chaos and noise within our minds. And this act of focusing your attention in a new and different way, of letting go of some of those patterns of thought that have really dictated how and when you move forward or what you're doing and how you're responding to things, it's a way of quieting your mind. This also requires an attitude of acceptance or observation, being aware of what's happening in the here and now, noticing everything about your physical experience, about the environment around you. It opens you up to this idea of seeing things as they are. We're often focused on control, exerting control in any way that we can, and changing things in ways that we believe to be beneficial. But observing the here and now, it takes away that sense of kind of needing to change or adjust anything. It's just about noticing what's happening in the moment in a general attitude of acceptance and observation. This next point is that it encourages non-judgment and non-striving. Now, why is this phrased in this way, non-judgment, non-striving? Because about 99% of the time, the entirety of our attention and our focus is on either passing some sort of judgment or looking at our experience through a lens of judgment. This is good or bad. This is helpful or unhelpful. This is how I should behave. This is how I shouldn't behave. Or goal-oriented. So everything about how we structure basically every part of our lives is about meeting that next goal or achievement. It's about competition. It's about striving. And we tend to kind of utilize those principles that are taught to us in a very abstract way and put them into practice in our moment-to-moment lives in very subtle and consistently stress activating ways. So it's important to be present during meditation in a non-judgmental and non-striving way. Another outcome or kind of skill that's being practiced is working to decrease attachment to your current experiences. Well, I'm sorry, decrease attachment to experiences overall, not your current experiences. The act of observing and recognizing the kind of fleeting nature of our moment-to-moment experience allows us to recognize that something else is coming in the next moment, that we can be here and just be without needing to prepare for or hold on to these moments that happen. Often, especially when we assign kind of positive value to a particular moment in our lives, it feels very fleeting. And when we think about the negative things that we've had to cope with, some of them can seem to last forever. And in truth, that says more about kind of our thought process and our understanding of those moments than it does about the moments themselves. All of those moments actually happened in about the same amount of time and in the same fleeting nature. And so it's important to work toward not attaching kind of so much meaning to every experience that we have. Increasing self-awareness is another component. Being able to really observe yourself in a very different way than you normally would. Practicing patience, which again kind of is a counter point to this idea of recognizing that you don't have control necessarily over the current moment, accepting the fact that you're going to experience it, and being able to wait and observe what happens. And the last kind of list of outcomes, skills, kind of activities that are occurring here is really this work to cultivate what Jon Kabat-Zinn calls a beginner's mind. I'll refer to Jon Kabat-Zinn several times over the rest of our kind of time together today, but he's really someone who's advanced the idea of mindfulness meditation, and he's actually a molecular biologist by training, but very, very interested in understanding and developing treatments for meditation and specifically mindfulness-based stress reduction. So Jon Kabat-Zinn talks about this idea of beginner's mind, which is really more easy to understand when you lay it next to this idea of expert mind. When we consider ourselves an expert, we know things about our experience, about what to expect. We kind of close ourselves off to learning from our environment in new ways. And when you adopt a beginner's mind, excuse me, you adopt the idea of not knowing, of being ready to learn, of being ready to kind of understand and experience things in a new and different way. And that's incredibly important in this kind of observational element of focused attention that is meditation. All right, next slide. So let's take just a minute to talk about kind of how some of those principles we were discussing embody themselves in two different kinds of meditation. To be fair, I'll say mindfulness-based meditation is not necessarily like one approach to meditation, whereas transcendental refers to kind of one more specific approach. But both are labeled for the particular skill that is utilized most directly with the active approach to focusing your attention in each of these tasks. So a mindfulness-based approach focuses in on this idea of becoming mindful as opposed to mindless. When we're mindless, our attention is kind of bouncing between all of these different things that catch it, these different stimuli. Some of them are in the current moment, some of them are in the past or in the future, some of them are internal, some of them are external. And in order to become more mindful, it's important to work toward being aware of the current moment in a non-judgmental and non-striving way, and just be present. Recognize that your only goal is to be. With transcendental meditation, this word transcendental refers to the core process or skill, which is to transcend the process of thought and achieve connection with a sense of stillness or inner calm that exists within your being. Now, in transcendental meditation, as I'm sure many of you know, that's achieved through a mantra chant, this monosyllabic mantra that you repeat. And that kind of core central focus on the mantra that you're repeating allows you to kind of separate from these traditional patterns of thinking, to focus in on your state of being, and to really be able to kind of acknowledge a sense of calm. Transcendental meditation requires that you practice twice a day for 20 minutes a day, and they recommend that you be seated in a comfortable position with your eyes closed. Mindfulness-based meditation It can look a lot of different ways, honestly. As I mentioned, the core in mindfulness meditation is working to cultivate this mindful frame through focused attention in the current moment. And often that attention is either based on something you're observing or something you're working to kind of acknowledge and let go of, like your thoughts. Or you might be observing your current presence, your breathing, your physical sensations. It's recommended for both practices that you engage in them daily, which is the only way to really create a well-oiled regimen of practice. But the time can be variable. I often encourage beginners with meditation to think about kind of mindfulness-based approaches that can be applied in moments of day-to-day activity. Which really involves kind of doing one thing at a time. So mindful eating involves when you're eating, only eat. Notice what the food looks like. Notice how your silverware feels. Notice what it's like to chew, what smells you're experiencing, how your body feels when you're eating. When we sit down to eat, how often do we ever just eat? We're usually planning for something else that's going to happen in our day, or thinking about how and when to execute our next big goal or plan. So there's an element of utilizing mindfulness that can be directed in active ways, as opposed to these kind of passive ways that we traditionally think about engaging with meditation, which is seated with your eyes closed and kind of in a very Zen position. Also activities like yoga, which are not traditionally considered meditation alone, but kind of hybrid models of engaging in physical exercise as well as meditation, they pick up a lot of these principles that are put forward in mindfulness, which is a focus on the current experience in the current moment, but in a slightly more active way. All right, next slide. So now that I gave you all that abstract discussion about what it is to actually meditate, before we get into our meditation exercise, I want to give you a moment to kind of digest an analogy that's utilized by many meditation teachers. And that's the analogy that Jon Kabat-Zinn creates in one of his first books, which is called Wherever You Go, There You Are. And it's this idea of thinking about your moment-to-moment experience as being in a river and finding yourself kind of in the middle of a river in which the current is very strong. And you find yourself moving through the river dictated entirely by that current. And even when you try to move or you try to swim, you're not really successful in going anywhere that you want to go, that you're really being dominated by the things that are happening in this river that you're fallen into the middle of. And it's hard to see, and you feel like you're getting hit by multiple things that come at you. And this is an example of kind of a visual understanding of what consciousness is for us in a moment-to-moment way in most of our life. That there's a lot coming at us, that we're balancing a lot of internal factors, and we're reacting to a lot of external factors as well. And the goal, the work of meditation, of being present in the current moment, of observing your experience in a moment-to-moment way, it's about sitting on the riverbank as opposed to being submerged in the river. It's about watching the current, understanding why it goes where it goes, thinking about what that current means, what it looks like, how you understand it, thinking about your reaction to the current, and finding enough distance for yourself to be able to process and understand the current of that river without finding yourself constantly being dunked under in shocking and surprising ways. So that's a little bit more of kind of a visual image of what these skills and practices of meditation kind of offer us the opportunity to do. Next slide. All right, now let's get down to some of the nitty-gritty. How do I actually meditate? Next slide. So in terms of building a practice of meditation, as I said, it's very important to find significant moments when you can set aside the time to focus on meditation. Now, sometimes this can be active, sometimes it can be time that's more passive. Most meditation teachers recommend finding some time at the beginning or the end of your day. And in a particularly chaotic environment, it can be hard to find those times. I say start with as small an amount of time as you need to. It can be as little as 2 minutes, and that can still make a difference if you can do it in a routine way. And as you're able to practice consistently, you'll find yourself able to engage in longer and longer periods of time. I do recommend for beginners utilizing resources to engage in guided meditations, because it can be a lot to try and meditate on your own. There are a lot of apps, podcasts, lots of different books. I will say I'm generally anti using technology to meditate, but it can be an important element of initially engaging with this process. So I list it here anyway. I also encourage people who are beginning to think about meditation to kind of recognize both this formal practice that we're talking about establishing and what it means to informally utilize a lot of these skills of mindfulness or meditation as well, and how they come up in your day-to-day life. And consider incorporating other kind of physical approaches to taking on this more mindful or meditative frame of mind. All right, next slide. I want to get us to our breathing exercise so we have time to kind of talk through our reactions. So I'm going to go ahead and guide us through just a short 3-minute breathing exercise. And I want us to focus in on that skill of mindfulness, of being aware of our experience and our presence in the current moment. So I'm going to introduce this exercise. We're going to go through the exercise together. And then afterward, I'm going to ask for people's kind of reflections about their experiences. And if you're willing to share with us some of your own kind of challenges or feelings about what it is to actually go through this meditation exercise. All right, let's move on to the next slide. I'm going to give us an abstract image to focus on. So if you feel comfortable, I do recommend closing your eyes as we go through this exercise together. But if you don't feel comfortable doing that for any reason, then I recommend that you kind of focus in on this abstract image and allow yourself to just kind of not focus in on anything specific, but just let yourself experience what that looks like while you go through the breathing exercise with me. All right, so now first, I want everyone to kind of find a comfortable position where you're seated. If there are other things on in the room, I want you to turn them off, to not look at your phone, to kind of turn off the television, whatever else you might be interacting with. And I want you to find a comfortable place to sit. I want you to first kind of scan your body and notice if there's any tension in your muscles. Maybe roll your neck or your shoulders. If you do notice any tension there, give yourself a moment to just kind of release that or work to untense those muscle groups. And as you're kind of noticing your body and your experience, I want you to close your eyes and just focus in on your breath. I want you to breathe normally and to notice what your normal breathing feels like, how slowly or quickly it's happening, where in your body you feel that breath. Notice the muscles in your abdomen as you breathe. Notice the tension and the release of tension in your shoulders. Notice how the breath feels when you take it in. And the shift in the moment when you move from inhale to exhale. As you're noticing your breathing, I want you to work on slowing it down for a moment, particularly your exhales. Notice when you slow that exhale, is there any difference? Does it feel different in your body? If you notice your mind wandering or other thoughts kind of entering your awareness, I want you to just notice them and not hold on to them. Let them slip away in the same way your breath slips away as you exhale. Allow yourself to notice exactly where your breathing is changing. and how the breath feels in your body. If you notice any discomfort in your physical positioning, I want you to feel free to shift or move. And as you do so, to just recognize how your body sensations change. And then come back to your breathing. Now, when you're ready, I'm going to ask you to open your eyes. And as you do so, I want you to continue noticing your breath, allowing yourself to return to just a comfortable, normal way of breathing and checking in with your body, noticing how or where any tension exists, your comfort level, how you're feeling. And I'll ask Anya to move us to the next slide. And I want you to think about, what did you notice? Were there things that kind of came up that surprised you or you hadn't been tuned into before while we did the breathing exercise? How did you feel during the exercise? How do you feel now? Were there any particular barriers or problems that you really specifically encountered when you were engaging in this exercise? And if you have responses to these questions, I would encourage you to share them in the chat. I believe Dr. Goodman is monitoring so that we can indeed talk about them if people are willing to kind of reflect on and share their own experiences. While people are kind of working to reflect a little bit, I will mention kind of just a few things about our experience that research indicates. One, as we've mentioned, is that this engagement with meditation leads to actual kind of changes in your physiological response to stress. It also, as we know from kind of brain imaging, can lead, if focused practice is engaged in, to changes in the way different parts of our brain communicate and interact. I think I was incorrect in directing you to the chat. I think that if you do have reflections, you have to offer them in the Q&A section. All right, well, I hope that everyone who was able to participate in the activity did really have kind of a sense of calm. And I think once you're actually able to engage in a moment of meditation, it doesn't feel so abstract to consider some of these very kind of concrete outcomes that can come along with it. I'm wondering, I see a couple of things popping up here. I'm glad to hear that one participant said that they felt calmer in the moment. And yes, as Anya noticed, it's very difficult to quiet the mind. That's kind of one of the most consistent and challenging struggles. And one of the skills that, I mean, is so so indicative of why we have to practice, right? I know I mentioned before this idea that meditation is like lifting weights for your attention. You can't start with or expect to begin bench pressing your body weight, right? You have to start with, 2-pound weights or 5-pound weights. And it feels challenging every time you kind of move up or change that intensity of focus. And it's particularly important to recognize that the goal isn't to get rid of all of those thoughts. Having a sense of better control over where your thinking goes is definitely one of the outcomes, but the goal of being present is just to allow yourself to acknowledge your experience and let go of thoughts when they come up. And we can talk a little bit more about kind of potentially some strategies for doing that in depth with our question and answer as well. All right, let's move on to the next slide so I can take just a moment to kind of talk a little bit more about what research tells us about what's happening for our minds and bodies in a moment of meditation, and especially with sustained practice of meditation. As I kind of started to say a moment ago, if you're able to practice in a consistent way in the long term, there are actual changes in our brain activity. There are also a lot of ways in which our kind of sense of measuring stress through a variety of different biomarkers shows an overall decreased response to stress. There are also outcomes in blood pressure, which again can be very activated by stress and stress responses. There are also consistent self-reports of decreases in chronic pain, in negative emotions like anxiety, worry, sadness, and anger. And also, there's a sense over time of an increased ability to kind of control or separate from your emotional experiences in very meaningful ways. So that's kind of a general sense of a lot of the ways that we do understand from a scientific, rigorous research perspective that our stress response is being moderated and limited or turned down by the act of meditation. Next slide. In terms of specific issues with cardiovascular health, an important thing to kind of recognize is that there's a lot of promising initial research that indicates that meditation can help us limit or mitigate risk factors in terms of poor cardiovascular health outcomes, predictions for poor cardiovascular health outcomes. But there's very little research that's really looked closely and carefully at specific populations of people who suffer from cardiovascular disease or who are at high risk for mortality from cardiovascular disease. There are promising findings in the area of kind of thinking about people who are managing cardiovascular disease, mindfulness-based stress reduction treatment, which is an 8-week treatment that incorporates both yoga and mindfulness-based meditation and was designed by Jon Kabat-Zinn. It shows that in patients who suffer from cardiovascular health problems, as opposed to kind of patients patients who suffer from cardiovascular disease were placed either into a control group or a mindfulness-based stress reduction treatment group. And those who suffer from cardiovascular disease and dealt with mindfulness-based stress reduction significantly lowered their stress and anger levels as compared to a control group that just engaged with health information. And in terms of understanding mortality information and our mortality risk, there were 2 promising but also very small and not necessarily highly controlled studies that were randomized clinical trials that looked at transcendental meditation versus other kind of control group options like basic health education or kind of standard care. And they showed a 30% reduction in cardiovascular mortality for a group that was combined both of healthy elderly adults and hypertensive elderly adults. So I know that's not kind of a lot of an incredibly rigorous scientific research, but what it does tell us is that there's a lot of promise, and hopefully there will be a continued focus and funding dedicated to this line of research so that we're really able to engage in more randomized controlled trials, which are the gold standard in understanding if the specific exercise of meditation can really be helpful in improving cardiovascular health and decreasing our overall risk as well. All right, next slide. I'm not going to go through this entire slide because I know we're running out of time, but I do want it to be here so that everyone has the ability to kind of go back and look at some additional resources that are available, both from the kind of books or web-based resources, applications, and podcasts. I also encourage everyone, when you're thinking about building a meditation practice, to really think about how some of these principles we talked about are relatable in your day-to-day life and approach to structure and routine. It's incredibly important to find ways to connect with meditation that fit into your life. Otherwise, you're never going to do it. And we do have to work to make that space, but it's important to think about making space in ways that are a good fit for you and what you know about yourself. All right, next slide gives us just some references for this particular presentation. Some of these are very kind of hardcore science papers, and some of them, like Robert Sapolsky's book, are great kind of overlapping resources for people who are really interested in science but are non-scientists. I do highly recommend Why Zebras Don't Get Ulcers if you're at all interested in understanding the stress response in an in-depth way. All right, and the next slide just offers you my contact information because I'm always interested in hearing more. I know we've only had a contained amount of time to engage with this topic together today, but I really appreciate your patience and involvement, and I am always open to kind of further discussion if other questions arise. Thank you.
I'm hoping to get my... Dr. Mazza, thank you so much. That was terrific. I really enjoyed it. I meditate myself, and I think you gave such a great lecture, and it was very, very inspiring. And all I can say is that when you start doing this, it's sort of difficult. And as you pointed out, you know, you have to make time. You don't really feel it like you want to feel it. But as you do it more, it becomes something that I would say is a positive addiction. And you start to realize how much it's helping you during the day. We don't have a lot of time. I want to cover the questions first that I got during your talk. Maybe you can just answer rapidly, shortly, so that we can get to all of them. Question was, is it best to inhale, from Barbara, inhale and exhale through the mouth or the nose, or the one or the other first? What do you say about that?
I say stop worrying about what's best and just breathe. So this is a good question, Barbara. I think try each and notice what it feels like and what the difference is. But the kind of entire goal of meditation is to let go of this idea of there's one best way to do it, and just to try and be present in the moment. So there isn't one right way to breathe. Try both.
Okay. I'm sure you're going to get this question. A lot of times there's a suggestion that you count for a number of seconds, 4, 7, 8. And so the question says, is that important? And why is it long? Why do we need to have a longer exhale?
So the longer exhale really relates to the physiological level of response. Taking these long, slow exhales, as opposed to kind of changing your breathing in another way, actively works to kind of let go of this compression that happens in our blood cells, to kind of release and open up the flow of oxygen in our system. And so that's one of the reasons that focusing on the exhale is important. The counting is really just a way of kind of tracking your experience to some extent as well. So I usually tell people to start with a nice slow 1, 2, 3 exhale, but your ability to kind of extend that exhale is a sign of a relaxed and calm state.
So on a personal note, do you breathe through your nose both times, or are you going in just out of interest because you're obviously a professional meditator?
I certainly don't feel like a professional most of the time. I usually breathe in through my nose and out through my mouth, but I also at certain times of year focus on breathing entirely through my mouth, because I do tend to kind of get very stuffy when the air is dry. So for me, I try to notice what feels most comfortable when I'm engaging with it. My go-to is in through the nose, out through the mouth.
Okay. There were a couple of people, Isabel and Karen, saying something so important. You know, it's so hard to just kind of put obtrusive thoughts aside. And what do you do? These thoughts are coming into your head. And I know that I've learned TM, and I was just told, just let them go. Don't focus on them and don't even think about them. What do you say when these thoughts are coming into your head? There's just nothing we do. It's all day long.
Absolutely.
So
We're used to this barrage of thoughts, and I think we often get lost in them. So really the first part of the process is kind of noticing those thoughts as opposed to kind of just having them happen or come at you all the time. And then I think there are actually a lot of interesting ways to use visualization as an approach to try and help you let go of those thoughts. So one approach is thinking about yourself kind of standing by a body of water, and each time you notice a thought, you're letting that kind of drift out into the water. One thing that I tried to kind of articulate in the actual exercise today, I like to visualize breathing my thoughts out and kind of feeling that breath and thinking about kind of my thought being on that breath and moving away from me actively as I exhale. But there are lots of different ways to also think about using labeling focused meditation exercises. So if your thoughts are feeling particularly overwhelming, you can start to label a worry, a plan, like just to notice it. But this labeling activity forces you to kind of move on to the next one and let go of, or not focus on, or get caught up in that thought as it comes up.
good thought. Susan wrote that she felt very relaxed and she didn't want to leave the moment. I'm going to throw something out that could be an amazing thing starting in this program, is that maybe you'll come up with 5 minutes or 10 minutes in the morning. You have a soothing, wonderful, relaxing kind of voice. And wouldn't it be nice if people on our, in our family can tune in? Maybe it's a phone call, because I know they do that with TM and a lot of meditation. But I wonder whether you would consider that. And maybe we could start up, maybe you just put it on a recording. I mean, we can't expect you to be in the same place. But I think that if people have to call in and they get, 10 or 15 minutes of, oh my goodness, sorry about that.
And here is why we need mindfulness, because we're constantly being distracted by all of these other stimuli.
Even when I try to switch everything off. So I think that would be something to think about. There was a question at the end there about how long you have to meditate. With TM, there are good studies that it lowers blood pressure. They also did a study showing that you actually can reduce the incidence of atrial fibrillation, which is an arrhythmia, even after people have had ablations. And so our department is very keen on getting people to do yoga, meditation. And it's all about what you were saying. When you've got sympathetic overdrive, when you've got this feeling of being stressed, it just stimulates your heart and you're more likely to have an arrhythmia. The questioner was, how long do you have to meditate? I know with TM, it's 20 minutes twice a day is the recommended amount. Do you have anything to say about other techniques? That would be I would say the guideline for getting optimal benefit.
Yes, so with TM, it's definitely 20 minutes twice a day. I try to kind of get people to start their meditation process, not thinking necessarily just focused on time, that this is a goal, like that's setting a very kind of rigid frame. But you're absolutely right with the research. The indication is that twice a day is definitely positive, whether it's TM or a different kind of meditation. And even as little as 10 minutes twice a day can have lasting impacts. And each different kind of approach of treatment, like mindfulness-based stress reduction, has a different kind of set of guidelines, but they're also trying to attack different problems. So it's important to think about what your needs are and utilizing the time that you can to engage in a mindfulness activity that's really geared at building skills that will be helpful to you as well.
Thank you. There was somebody initially who asked, I'm sorry, I lost the front screen here, but about resources. You did a beautiful job of putting up resources. And of course, we'll make those available to anybody if you want to get it, the slides or that particular slide. You just have to email us and Anya will send them to you. Just to end off, I once heard this definition of stress, which you went into today, and it kind of stuck with me. I was kind of able to just remember, what does stress mean? And this was the definition I heard. Stress is the subjective sensation of an inability to cope. And what that made me realize is just because somebody, you don't feel stressed crossing the street or flying or worrying about what's going on in the world doesn't mean that somebody else isn't. And I think we have to be really mindful that we don't know what it's like to walk in somebody else's shoes. And when they're stressed about something, because you're not stressed about that doesn't mean it's not stressful. And I think acknowledging what stress means is, to everybody, it's different. And I think that's a good start, when you are tolerant and kind to people who are feeling stressed, so they don't have to feel so isolated. I think you did an amazing job. I want to thank our the people that came on. We really appreciate it. I think you hopefully inspired some people to get started with meditation. I'll leave the last word to you, and I want you to think about setting up something where we can hear your voice every morning for maybe 15 minutes.
Well, I would enjoy that thoroughly. That sounds like a wonderful way to engage with meditation. And thanks to everyone who participated and who will engage with this webinar in the future. I hope you feel motivated and encouraged to start your own practice of meditation. And while it's a difficult practice to engage in, it's well worthwhile from my experience.
Well said. And on the last note is to thank Anya Coates and Michelle Yu. Thank you very much, ladies. We really appreciate it.
Yes, thank you so much.
And we look forward to seeing you all at our next meeting. Thank you, Mary, and good evening, everybody, and start meditating.